Doctor, exactly what is chickenpox? Chickenpox is an acute contagion or contagious disease chiefly affecting children. And it may cause difficulty? Yes. Is there an incubation period? Yes. How long? 10 to 15 days. What is its cause? Its cause is unknown. What are its symptoms? The symptoms are an increase of temperature, rash consisting of small vesicles or pimples containing clear fluid, which appear after 24 hours and may be preceded by a diffuse redness of the skin. Doctor, after 2 or 3 days, the vesicles shrivel, do they, and leave a small brown crust? Yes, that is true, which then drops off and, as a rule, leaves no scar. And the rash, doctor, is most marked on the trunk? On the trunk, yes. The mode of spread is by personal contact with an infected patient. And doctor, the sequelae? The sequelae is nephritis. And the duration is 3 weeks. Infective units are on all the spots that appear. Doctor, what is the incubation? It is 2 to 7 days. And the symptomatology? It is sore and inflamed throat, grayish membrane covering the infected mucous membrane, dyspnea due to partial obstruction of the air passages by the membrane, which may cause complete obstruction and suffocation instead of temperature. Doctor, the essential part of the treatment is the use of diphtheritic antitoxin? Yes, diphtheritic antitoxin, which is frequently necessary to open the larynx in the neck below the obstruction which is caused by the membrane in order to enable the patient to breathe. And doctor, this operation is known as what? It is known as a tracheotomy. And the opening is allowed to close as soon as the membrane is separated. Is that not correct? Yes, that is correct. It is a normal breathing apparatus. Doctor, the complications are cardiac weakness, neuritis, bronchopneumonia, nephritis, paralysis, frequently of the palate. Yes, that is right. From 6 weeks upwards, incidentally. And the organism may remain active in the throat and infection for other people long after all symptoms have disappeared. Does this occur in several forms, doctor? Are you referring to dysentery? Yes, dysentery. Is that caused by the amoeba dysenterica? Yes, it is caused by the Bacillus dysenterica. And the amoebic dysentery is what? It is a disease that occurs chiefly in the tropics. Its symptomatology is acute abdominal paths or pains, and tenesmus, which is an intellectual desire and straining to evacuate the bowel. Passage of blood and mucus per annum, increase in temperature, emaciation, chronic alternating constipation and diarrhea, recurring slight increase in temperature, pain in abdomen, and tenesmus with recurring passing of blood and mucus. Doctor, what are the complications? The complications are perforation of the bowel, followed by general peritonitis and abscess of the liver.